Facebook Live. Dr. Jim Heiss here from Door County Medical Center here in beautiful Sturgeon Bay, Wisconsin. Thank you so much for joining us for tonight's discussion on COVID-19. I know it's been something that obviously is big and looms large in all of our lives, but sitting next to me is my colleague, Sue Powers from Door County Health Department. Thanks for being here, Sue.
Thank you. Hi, I'm Sue Powers. I'm the Health Officer and Public Health Manager from Door County Department of Health and Human Services. And before we get into the meat of our presentation and ask for your questions, I just want to really thank Door County Medical Center for organizing these media presentations. So at Public Health, we've really been busy following up on possible cases, working on the front lines of coordinating with Door County Medical Center for patient care and patient education, and media and putting out messages to the public has had to take a back seat. So I really appreciate that Door County Medical Center is facilitating all this.
You know, it's our privilege to do this, and you know, we really like to, along with the Public Health Department, be the leaders in the county for this information. You know, we are right now in unprecedented times. There have been things that have been occurring, news reports that we're hearing that none of us have experienced in our lifetime and maybe never will. So the big thing that we really want to, I guess, message that we want to put across is this is not a time to panic, not a time to live in fear. This obviously is a very serious situation. We're doing our best locally to stay on top of it. And we're going to talk quite a bit tonight about some of the things that we're doing and some of the concepts behind what can prevent this from getting worse. So before we get into any of that information, Sue, why don't you give us an update as to the state of things in the Door County area?
Sure. So Door County Medical Center is currently the only facility that is providing testing, and actually that's wrong. They're not doing the testing, they're doing obtaining the tests and sending them to the state lab for testing for coronavirus. So if your medical provider isn't from Door County Medical Center, we want to encourage you to communicate with your own medical provider, but they will either coordinate with Door County Medical Center or send you to a Green Bay facility for testing if they feel it's necessary. So far in Door County, there have been 16 people tested for coronavirus. Not all the results are back, but the ones that are back have all been negative. So we do not have any cases of coronavirus. Nobody has tested positive so far in Door County. As far as the state, across the state of Wisconsin, there are 47 confirmed cases, and 13 of those are in Milwaukee, 11 are in Fond du Lac County, and 10 are in Dane County.
I think the closest one to us right now is in, I think it's Winnebago County or Outagamie County. I'm not sure which. Is it Winnebago?
Winnebago.
Thought so. Yeah. So you know, it's close to us, but thankfully we've been spared. So one of the things I want to start out talking about is what can we do right now to prevent a surge or to prevent positive cases? You know, I think it probably isn't too much of a stretch to say you kind of ought to expect that we're going to have some positive cases in the area. I think that's sort of an inevitability, but thus far we have none. Many of you have heard the term that is sort of new in our lexicon, and that is social distancing. And we wanted to talk about what does that really mean and how can that be effective. One of the other pieces to that you may have heard is this concept of flattening the curve. So what are we talking about with flattening the curve? So I actually have visual aids tonight with this. So I'm going to put this up. Hopefully I don't knock Sue with this. So you can see here the concept of, if you look here on this axis right here, that's the number of daily cases. And on the bottom axis, that's the days since the first case. The dotted line or the dashed line here is our healthcare system capacity. What we don't want to have happen is a lot of people get infected, and you can see without protective measures, we quickly go above the health system capacity. If we're able to stop this virus from spreading, we can stay below the healthcare system capacity with those protective measures, and we'll do better in the end. So when we talk about social distancing, We're talking about things like, now that your kids are going to be off school and some of our local districts are going to be having spring break next week, we're talking about not going to McDonald's Play Place, not going to Tundra Lodge to a water park, not going to places where a bunch of people are together, because again, we want to distance ourselves so that the virus doesn't spread. I saw an analogy actually on Facebook, ironically, which is really interesting. And the concept is this: if you think of my fingers here as matches, and they're kind of close together, let's say I light the match here. What do you think is going to happen to this? This match is going to light, followed by this match, followed by this match. Before you know it, all of them have lit. So think of that as becoming infected. If we distance ourselves, if we practice social distancing, keeping apart, staying in our homes, not going to places unnecessarily, you light this match, it's going to end there. It's not going to trigger this. It's not going to trigger this. So that's the concept behind social distancing. Certainly go out to the grocery store when you have to. And when you do, when you come home from that, wash your hands with soap and water vigorously for 20 seconds. Don't touch your face until you've washed your hands. And you know, if you're like most of us, the minute we say don't touch your face, what's the first thing you want to do? Scratch an itch on your face. That's human nature. But wash your hands. If you're sick, don't go to work, especially if you have a fever. Don't go to work. So I guess that's the most, that I think is the single biggest thing that we all can do in order to try and prevent spread of this disease. That's the reason we're seeing everything we're seeing in the press. That's the reason the schools have been closed. That's the reason why in the state of Illinois and the state of Ohio, I think it was, as well as a few other places, the governors of those respective states have required their restaurants and bars to close. Why? Because we saw people in those restaurants not understanding that you shouldn't be there with a group of people. So that's why all these closures are taking place. So I don't know how I can more strongly put that. I think it's all of our individual responsibilities to do our best to prevent this. I also think that if we do this, this is going to end a lot faster. If the horse gets out of the barn, so to speak, we're going to be in this for a long haul. So the more we can keep ourselves isolated, the better off we're going to be. I don't know if you have any thoughts.
I really like your analogy. Hadn't heard that one before. And I think the recommendations that have come out from the state and from the CDC about not meeting in large groups and schools closing have been really upsetting for all of us and disrupting our lives. And unfortunately, I think it's caused some fear in Door County, and nothing is happening right now. We don't have cases, and there's no reason to think that COVID-19 is spreading across Door County. But what we need to do is just be prepared. And so it's a message of preparedness. I'm not sure if everybody is aware that our county administrator today did declare a state of emergency for Door County. And if I can get it on my phone again, I can talk a little better about it. So it was our county administrator and the chair of the Door County Board of Supervisors declared a state of emergency in response to the COVID-19 pandemic. And the declaration will allow for public health, protection, safety, and welfare within Door County and hasten the availability and use of resources by the county with prudent and reasonable steps according to the proclamation. So it's a good way for us, a better way for us to track financial things and also to be able to act quickly if we need to.
Yeah, and Sue, I see one of the early comments. Tracy commented, can you please tell people who want to come to visit the county right now to please stay home? You know, that is just a specific example of what we just talked about. If you don't, if you should, I think travel right now is a bad idea, flat out bad idea. If you're going to get on a metal tube, which would be an airplane, and flying somewhere, you are at significant risk. Now, having said that, let's talk about some of the testing criteria. Let's talk about testing, because I know a lot of people will get a cough or get the sniffles and they'll say, oh my God, I want to be tested for COVID. So let's talk about First of all, let's talk about the criteria we're using to test appropriately. And then we'll talk about some issues as far as why is it that we're not testing everybody and what are the issues surrounding that. So why don't you start by telling us the criteria, what we're looking for when you call us.
Sure. So first of all, I have to say that the criteria is changing all the time. According to the situation is changing. A few weeks back, it started out, testing was only recommended if you had traveled to certain places like China or come back from China or Italy. And that's relaxed a lot as there are more cases in the country. So what it comes down to is your healthcare provider can order the test for you. There's nobody at the state or certainly not local public health saying your doctor can't order that test for you. But your doctor is going to look at, and you can help here, what symptoms you have. Do they line up with coronavirus? And right now, do you have a travel history of anywhere to concern? Or have you been exposed to an actual diagnosed coronavirus case? And so there's a lot of concern and I think a lot of fear around testing, that there's not enough tests. And I certainly can't speak to what's happening across the nation, but in Door County, I believe anyone who's wanted and their physician, healthcare practitioner has wanted them to be tested has been able to be tested.
Yeah, we've had no inability to test people. But I think the important thing to remember is with any testing we do in medicine, and certainly now, we want to make sure that we're testing for the right thing. So one of the things that we can say at this point, and again, as Sue mentioned, things change on an hourly basis, but as of right now, and actually it's been the case for pretty much since this has begun, if you haven't traveled to one of the countries that are of concern, so Italy or South Korea or any of the countries where there has been an issue, if you haven't traveled to those, or if you haven't been exposed to someone who has positively been tested to have COVID, you're not going to have it. That may change down the road if community spread happens, which would mean someone who had traveled, came here, tested positive, and unfortunately spread it around. That hasn't happened yet. So what we're trying to avoid doing is testing everybody indiscriminately. Now, we may get to a point where we can do that. Right now, testing is a limited resource, and that's the big issue that we have. It's not for lack of desire to test. It's that we have two labs in the state that do it, that's all. We have, around the country, we only have so many viral swabs to swab people to get the test. So we need to be prudent. I guess we have to be good stewards of our resources to make sure that we're not testing where the diagnosis is likely not that. So there'll be developments that'll be coming in the next days as far as where will we test, how will we go about doing that, and that information will be put out as it comes. But I just want you to understand that it's not a matter of saying, well, we don't want to test you because we don't think you have it. It has to do with what are the criteria that gets us to that decision point. Does that make sense, Sue?
Perfect sense to
Okay.
me. And I might also add, there's been a lot of concern about where did the tests go? What is it about these kits?
I'm going to reach over here, Sue, and see if I can.
When people talk about test kits, there isn't really a kit. It's just referring to the reagent and the swab and the transport medium that the sample needs to be put in. And the reagent is at the clinical lab. So the only places in the state that are doing testing right now are Milwaukee Health Department or the Wisconsin State Laboratory of Hygiene. So your test from Sturgeon Bay needs to be couriered to Madison, and then they'll test it. And it depends on how many samples they have that day, and all those kinds of things. It used to depend on whether it was a weekend or not, but they were testing all last weekend. Mm-hmm. So there was quicker turnaround times.
Yeah. And a lot of things are changing as far as like visitation restrictions, for example, here at the hospital. We have instituted visitor restrictions at this point, and that information is on Facebook specifically, but generally what we're trying to do is limit the number of people that would come into the facility and perhaps either infect someone or be a carrier or become infected. Again, I keep saying this because I want everyone to understand we don't have any COVID cases right now, but we're trying to ramp up and prepare so that if in the event that this does happen, we're all set to go. Nothing would be better than for us to have all these preparedness measures in place and to not have to use them. That'd be wonderful because we already then are set for if this happens again. But we'd rather be over prepared than be caught with, I guess, our pants down, for lack of a better analogy, because you want to make sure that we're ready for our community in the event that something happens. You know what surprises me is that we're not having a lot of questions. I thought for sure we would. Maybe we're just answering them with our rapier wit.
So I would like to just talk a little bit about our community. And I think we all know that much of our community is older adults. Actually, almost 30% of Door County is comprised of people 65 and older. And those people are said to be more at risk for complications of coronavirus, the serious complications. So, and I think we, as a society, we like to think that we're all individuals. We're all our little island, and what I do doesn't affect others, but this is really a big lesson, and it certainly does affect others. So if you stay home when you're sick and don't infect me, and I don't infect grandma or some other older adult, we're all better off.
That's right. Sue, have you gotten any questions from businesses in town about what do you recommend they do? Have you had any questions?
We've had questions from all kinds of organizations, and what I'm telling businesses and faith-based organizations and just about everyone, we're trying to get the message out that a really great resource is the CDC website. And when you can't miss on their face page COVID-19, and you click on that, and it gets to all kinds of choices, and one is community, schools, and businesses. And when you get in there, they have a lot of recommendations and templates for plans for employers, for faith-based organizations, for any large gatherings. And of course, we all know that now large gatherings are no longer recommended, but a lot of your questions might be answered. That's a great starting point.
It is indeed. It is indeed. In fact, the CDC is really our source of truth, so to speak. You know, one of the things we've wanted to do from moment one is make sure that we have one source, a credible source that is factual and that we can go by. Because one of the biggest things that we do, I think, just as human beings is, you know, we love to hear stories. You know, so and so said they heard this, or so and so said they saw this on television. And that, I think, really makes the fear that you mentioned all the worse. So I think it's good to always keep in mind what we know to be true. So, you know, for right now, again, we don't have any cases in the county. We are, as an organization, we're meeting every morning with physician and administrative leaders from all the hospitals in Green Bay. So that would be the HSHS system, Bellin, Aurora, Prevea, and Holy Family. And every morning we have an update as to what is each system doing, and that's helping us make decisions as well. Our organization, we get together in our leadership structure and our incident command. We do that every day, if not twice a day. And our fearless leader is our CEO, Brian Stevens. And you know, when I say we've got this, I mean it. You know, with Brian at the helm, we really do feel as though we are prepared for whatever may come our way. So to whatever extent that offers some comfort, you know, I'm happy to offer that degree of comfort.
It's unfortunate that it had to be because of this, but because of this, our communication between the health department and Door County Medical Center has really been enhanced, and it's gotten easier every day to communicate. And I have been invited to their incident command system meetings, and that's helped both organizations. Door County Public Health has met with a number of organizations, especially within the county. We've met with county leadership to help plan and respond
Indeed.
What's going on.
You know, I'm just going to ask our technical folks that are behind the scenes, are there any questions that we're missing? Anything we're not seeing? I'm looking at the right side of my screen, and I want to make sure that we're not somehow missing questions. So we're going to check right now. We're going to make sure we're not missing anything. Oh, look at that. It helps to be technically savvy, which I thought I was up until right this moment. Let's start at the bottom. So Stacy, I'm so proud of our organization for keeping everyone well informed. Can you please explain to the viewers why we are not asking patients to don a mask when they come into their PCP? That is an outstanding question, and I'm glad you brought it up. The reason for that is the mask in and of itself will not help you prevent help getting, let me try that again. It will not prevent you from getting the virus should it be there. The idea is if you have a cough and you wish to shield your cough, as you should, from other people, you wear a mask to prevent your cough from being spread. If I, as the doctor, wears a mask, and that's all I wear, I could just as easily get corona, because if someone coughs, it's droplet, it's in the air, it can get in through my eyes, through my ears. You know, it's not a complete protection. So there really is no reason for people to wear a mask out to protect themselves. They're at every bit as much risk. Any comments on that, Sue?
Right. The mask is to keep the droplets from spreading out from you if you have a cough.
And here's another question that, and I'm sorry for having to lean forward, but you know, as you get older, you get blind. Janet, how many test kits do we have available in Door County? That's a great question as well, because everyone hears about test kits. And the thing to remember is the test kits themselves are at the lab that runs the test. So from our perspective, and from any healthcare provider's perspective, what we need is the swab with the viral media that is able to capture the liquid from the swab in a tube. That's what we need. We have, I don't have a number for you, but we have more than an adequate supply for that. The test kits, which is actually the chemical compound that allows the lab to run the genetic tests to look for coronavirus, those test kits are in those two labs, one in Madison and one in Milwaukee. Let me see if I can move this up here. So currently folks who have been out of the country to Italy or France are requested to self-quarantine for 14 days. Are they required to quarantine at the point of return in the US? Are they allowed to return to their home? I don't know that I know the answer to that. Do you?
So yes, they generally are allowed to return to their home and self-quarantine. Now, I don't know about all this cruise ship parameters.
Yeah, I'm not sure either.
I'm not an expert on that. I don't know the answer, but people who, such as students that are returning from studying abroad, are certainly allowed to return to their homes and are required to self-quarantine for 14 days.
I'm just asking one of our tech, asking one of our tech experts to come and see if we can slide up the questions, because for some reason it doesn't want to work for me. But finish what you were saying, I'm sorry.
And they're also instructed, should they be developing any symptoms of coronavirus, such as cough, fever, shortness of breath, that they contact their healthcare provider immediately.
And how long do test results take, Nicole? Thank you for that question. Test results are about 24 to 36 hours currently. So that's about what has been going on right now. It's fun dealing with technology.
You're doing great.
Well, there we go. Just want to make sure we haven't met. So Wally writes, as a hotel, we're planning on shutting down to the public for the next 15 days for now. Is that overreacting or appropriate? You know, that's an individual question or an individual answer. Is it overreacting? I don't think it necessarily is. I think right now, the purpose of all of, we're hearing a lot of 2-week things. You know, school is out for the next 2 weeks at least, and businesses are closing for 2 weeks, potentially, things like that. And that's because of what we mentioned about trying to flatten the curve and trying to prevent spread of the virus to dangerous levels. So I guess from my personal perspective, I applaud you as a brave business owner to try and be a part of the solution. I don't think that's overreacting at all. Would you have any other comments to that effect, Sue?
I agree, and it is an individual call at this point. It also depends on how many people would be gathering in one spot in your hotel. If you're going to have big meetings, certainly it's recommended that you do not have meetings of large groups.
Right. Katie has a question. What options are available to people without a primary care physician or people without insurance? As options as far as primary care is concerned, you can always call Door County Medical Center and speak with someone in our call center, and they can just talk to if you have symptoms and are concerned, and especially if you've been to one of those places that are of concern, and we can talk about what the next best steps would be. You don't have to have a primary care physician to ask those questions. As far as the testing is concerned, should testing be deemed appropriate and necessary, currently the coronavirus test is paid for effectively by the taxpayers. There's no charge to the individual. You don't need insurance for that. So I hope that answers that question. Just looking here. Let's see. Cynthia asks, I want to go help my elderly mother in Illinois, just my home to her home. She is diabetic, heart patient. Should I go right now? Again, that's one of those, from my perspective, I would say you're going by yourself to be with your mother. I don't see an immediate problem to that. Again, I think the idea is we want to keep people in the older population, our elderly patients that have, or family members that have medical problems, we want to keep them from going to places that where they are at risk for contracting any illness, much less the coronavirus. Any comment?
I agree, yeah, and it might be helpful if you got her enough medication, groceries, things like that, that she didn't have to go out for a couple of weeks, in case she should feel that she should stay in to safeguard her health, which might be advisable if there's cases in her vicinity.
Well, I'm just looking here to see. If you suspect you have the virus, do you call your doctor or go into urgent care? Mimi, that is a wonderful question. If you are concerned, if you maybe meet the criteria for someone that might have developed the coronavirus, if you've come back from a country that's endemic, or you've been around someone that you know has tested positive, your best bet is to call first. Let us know you have these concerns, and then we can give you next steps, because that's a much preferable option than just showing up and saying it once you get into a room and saying, yeah, by the way, I was with someone who had coronavirus. Again, we do all these things because we want to try and prevent the spread. So we want to help in any way we can. And with this particular situation, calling first is the best thing to do.
If they call first, then they'll be instructed to, I think the regime has been, unless it's changed, a nurse will meet the patient at the door and provide a mask and escort them to the testing area or to where the provider is in a private room for infection prevention reasons.
Next question that came up is Sadie asks, will elective surgeries be canceled? I keep saying this is a good question. They're all really good questions. But these are things that we talk about and think about every day. A lot of hospitals in Green Bay have started to do that, to limit elective cases. We have not made the decision to go that route yet. We are continuing to look at that to see where what the next best step would be. I think in our case, what we're seeing is a lot of people are self-selecting already. They're basically saying, you know what, I think this was elective. I'd rather wait until things have died down And I think that's a reasonable approach to take. So if we make any firm decisions about that in the near future, we will absolutely put that out on Facebook on a press release, so you'll know about it. So that's about the best answer I have for that right now. Let's see what else is there. Do I have any recommendations for those who might be able to stay home for financial reasons? I don't necessarily. Oh yeah, so Sarah asked, I apologize if this was already asked, how many residents in Door County have been tested as of today? I don't know if you mentioned that, Sue. Just say it again if we.
Sure, there's been 16 people tested, and there are currently no confirmed cases. You have that correct. Some results are back and some are still pending.
Right. And in fact, there have been quite a large number of tests that have been performed in all of northeastern Wisconsin in this area that we work with, and there have been no confirmed cases. So we still are free of that, which is we're very lucky. Peg, will you use virtual visits? That is something we are trying to set up the infrastructure for. It takes a lot of technology and planning to do that, and we're trying to speed up that process and see if we can't get that going, because in the end, boy, that'd be a great thing to be able to do. So as soon as we can get that set up and feasible, why, we're going to do that. I think virtual visits and online visits and care in general is something that we're going to be seeing in the future for healthcare. I think we're in a new era where people want to be able to be taken care of and seen in ways that make sense to them. So we certainly are looking at those options. All right, well, where are we at? We're at 6:30 right now. So Sue, do you have any last thoughts that you'd like to share with everybody?
I think our big message is what you started out with, social distancing, wash your hands, stay generally healthy, and maybe another message might be offer to provide groceries for your elderly neighbor or your neighbor who has a chronic health condition who doesn't want to go out. Maybe offer to deliver something to them so they don't have to go out and put themselves at risk or fear that they're at risk.
Yeah, well said. I think there's one last question we're going to address. I shouldn't say one last, I mean, we'll see what comes up, but any insights on when this will peak in our area? Any estimated trajectory of affected population? Those are great questions, and those are ones that I ask myself and we here ask ourselves, and we look at all the data. I don't think we have enough information to answer those questions right now. I will say one of the reasons that we keep harping on this social distancing is I saw a chart that showed Italy's trajectory, what they had gone through, number of cases by day. We're about 10 days behind Italy right now. We had the same number of cases they did 10 days ago, and they have risen significantly. So we're hoping that learning from that and learning from what they have done, we can prevent the spike in cases and prevent what we're seeing right now in Italy. And they've had a hard time as far as their healthcare system. Their hospitals have been full, and tough decisions have had to have been made. So that is really what we're trying to avoid. And I believe that we have every chance to avoid that by all being good citizens and doing our best to stay home and not go to places where we could become infected or infect others. All right. So I think with that, I know we said maybe 6:30, 6:45. I think we've covered a lot of information. I thank you so much, Sue, for joining me tonight.
Thank you.
It's always a pleasure. I think this has worked out really well. So I think we'll likely do this again in the near future when we have more information. I appreciate everyone joining us tonight. I wish you all the best, and take care of yourselves. And don't forget, practice that social distancing. That's really important. Take care. Have a great evening.